for today's press meet with all the esteemed press over here. I first welcome our beloved director, Dr. H.M. Siddharaju, who will be chairing this press meet today. This is basically for the Pulse Polio Immunization to be held on 21st of November this month for the children between age group 0 to 5 years. And this is unique Pulse Polio in the sense that places where there is a threat for maximum world polio reach, in those places Government of India is doing this or undertaking this pulse polio immunization. Andaman being a tourist place, it's very high sensitive. Although we have eradicated polio from India, the last case was diagnosed in 2011 and following that in 2014 the World Health Organization had declared India as polio free, including Southeast Asia. However, our two neighboring countries, Afghanistan and Pakistan, still are having this wild polio virus circulation in their country, and that may be a matter of concern for us because there is chances of importation of that virus to India, and that can lead to again outbreak of polio. That's the reason we are doing sporadic or intermittent pulse polio programs as national immunization round or sub-national immunization round. So this year Andaman is one of the part of that, and we have made ready with everything as like the previous years. Now these rounds will be conducted across the islands on 21st, that is on Sunday, followed by the first day will be the booth activity, followed by house to house mop-up survey on 22nd and 23rd, wherein our healthcare workers, Asha Anganwadi workers, the volunteers will visit house to house to find out children who could not be vaccinated due to some other reasons, or those who are left out or missed out. We are trying to cover maximum children on the first day itself, that is the 21st, in the booth. So I will be appealing all the parents and the islanders that on behalf of Directorate of Health Services that please do bring your children to the booth on 21st itself, so that our field activity can be reduced and we can have maximum coverage of this vaccination. For these particular rounds, we have been issued with 31,100 doses of bivalent polio vaccines, which we have already distributed across the islands. Then we have all the posters and banners printed, being distributed to all the places across the islands. We have a total of 489 booths across the islands, and the estimated children population between 0 to 5 years will be 20,666, 20666. And these children are distributed over three districts, and also the booths are distributed like this. In South Andaman we have got 239 booths, North Andaman we have got 200 booths, Nicobar we have got 50 booths. These booths are the permanent booths. We have last many years we are running the same places, same booth for this pulse polio immunization. We have covered all the jetties, harbors, all the entry and exit points, including your airport. We have already covered the places for hard to reach areas in Nicobar, one place in South Andaman, 2 or 3 places in North Middle Andaman, and maximum places in Diglipur area, wherein there is no regular mode of communication or transport. So we have already covered with the special outreach sessions over there, so that every person residing in the hamlets or small areas also being covered under this program. We have seek assistance from various members or various organizations, including the Jila Parishad, the Municipal Council, the District Health Societies, then Education Department. We have a Social Welfare Department who are helping us with ICDS, Airport Authority of India, Port Management Board, and the DSS. Apart from this, we have got special booths for defense area under Station Health Officer, Andaman Corps Command. So everything has been covered for this vaccination. Hope like last year where we tend to give 100% coverage, this year also this will be done. thing we require from the media is that we need a wide publicity from your end so that people come on the first day. And second thing, I want to appeal to all the people on behalf of my directorate that all the parents must bring their children to the booth on the first day itself. A special campaign in addition to this oral polio vaccination or pulse polio vaccination we have kept this time is that to find out the children who are missed out for the regular vaccination. Now, you know, we are giving vaccines to the children between 0 to 5 years, all 11 injections, 11 types of vaccines we give. Now, it happens that after taking one or two vaccines, the children do not turn up, or the parent do not bring them. In that case, sorry, in that case, this time while going to house, we will try to find out those children other than the polio, those children who hasn't got these routine vaccines. We'll try to make a list of them and then make a separate camp for them to vaccinate them so that we can reach higher and higher level in vaccination coverage in the islands. Our target is 100%. And Government of India is also insisting on a few more things. One is called as measles rubella elimination. The target is that this year we should be eliminating the measles and rubella, khasra jise kehte hain, khasra from the country. And for that we have got achieved, Andaman has achieved significant milestones because our surveillance system is one of the best. Still, you have to continue till the country is totally free of measles and rubella. So what we do is we try to find out fever with rash cases among people in the community. If any fever or rash cases comes, we take the sample, we send it to the designated laboratory, and then we test it whether there is a measles or rubella. If there is a measles or rubella case is found out, we take appropriate measures so that this virus can be contained in that region, and we try to prevent this to spread in the community. This is one of the things we are doing right now. For that also, we try to appeal through your media that people must understand any child or any person rather is having fever with any sort of rash. It may be dengue also can have rash, chikungunya can have rash. So even Andaman fever also can have rash sometimes. So there are 10 types of fever which can have rash, but any rash with fever, irrespective of the diagnosis, please do report to our health center so that your samples can be taken to rule out any underlying or as a coincident case of measles or rubella, so that island can be kept free of measles or rubella in future also. We are also insisting on acute flaccid paralysis surveillance, wherein a child below 15 years having any sort of weaknesses due to any unknown reason, we take their stool samples in 2 portions and send it to laboratory in mainland, and we test them if there is a case of polio or not. Now, I told you that we are polio free, but to keep high surveillance rate, this is compulsory till Government of India WHO declare that the world is polio free. In that case, what is more important required is for every district we need one sample. So sometimes in Nicobar we don't get it because people doesn't come forward to take the with the patient, because minor weaknesses in children some people tend to overlook. So I'll be appealing everybody that any weakness in children due to any unknown reason, please do report to us so that we can take the sample. It may be a case of other thing, but we should rule out the acute flaccid paralysis that is due to polio. Then we have one more thing in the place is that we are slowly trying to make this immunization process paperless in the country. In Andaman, we are trying to do it by March. There are a lot of hurdles are there. Something called as U-Win, like Co-Win we might have seen in COVID vaccination में Co-Win use करते थे portal. Same thing U-Win portal हम use कर रहे हैं अभी, and that is supported by Government of India and United Nations Development Plan. So this UNDP and WHO, Government of India both are combinedly supporting us in implementing this U-Win concept in Andaman. Wherein a mother is pregnant, the moment the mother is pregnant, we try to catch the mother and record everything, her vitals, everything or details in a software, in an app. So what happens is, once the mother is delivered, we can understand whether the mother is got full ANC coverage, whether the child born got the full immunization coverage. So the dropout rates or missed out children can be reduced because everything is online records. Some people, what happens, for Andaman, first dose they take, second dose they take in Andhra, fourth dose they take in Chennai. So sometimes it is not clear whether they took or not. At least this there will pop-up mechanism where this app will show you this child is date is over nearby and he or she has to be given the vaccination. Sometimes the parents themselves can see just entering the telephone number. Even the vaccination card can be generated online. So now you just you're reviewing your what do you call it, reading your passport also they ask for compulsory birth certificate. Now I got a lot of calls from abroad asking for seeking for birth certificate. People born in 1960 and 70 not able to give because nobody to verify that one. So this type of system this system will be online. Anytime you can generate anything. A child want to go to abroad for study, they want vaccination certificate. He can just download it instead of coming to us. So this type of things we are trying already implemented, and we have crossed more than 70% of coverage, and 30% is required. And people can they themselves register in that. It's not necessary that I am pregnant, the lady is pregnant and go to the medical hospital to register. They can themselves register. They themselves register for the child vaccination also, and then once the slot is booked, they can go on that day to the center and every details will be available on the portal. So it will save time, recording will be easy and recording will be permanent. So these are things we are taking along with this in the vaccination process. And again, I tell you that this time the special campaign, this campaign has to be successful. We need to have 100% of coverage of children. And again, appeal is that please people must come, the parents must come with the children to the booth itself on 21st. Those who are sick, there is some issues at home, the child cannot be brought, there's a different issue. Others, please try to bring the children to the booth and take the vaccination. So that's it from my side. I just want to, sir, to comment something on it, sir.
डॉक्टर अभिजीत राय ने जो स्टेट इम्यूनाइजेशन ऑफिसर ने विस्तार रूप से जानकारी दिया है, जो जैसे कि आप सभी जानते हैं कि 21 दिसंबर को नेशनल इम्यूनाइजेशन डे मनाया जाएगा। सारे भारतवर्ष का साथ साथ अंडमान निकोबार द्वीप समूह में भी नेशनल इम्यूनाइजेशन डे मनाया जाएगा। इसके लिए डायरेक्टरेट ऑफ हेल्थ सर्विस ने बहुत सारे तैयारी कर चुका है। सारे हमारा जो हेल्थ स्टाफ है, आंगनवाड़ी वर्कर्स है, आशा वर्कर्स है, एएनएम्स है, उन सभी को ओरिएंटेशन ट्रेनिंग और सेंसिटाइजेशन ट्रेनिंग दिया गया है। और सारे स्वास्थ्य केंद्र या बूथ वहाँ तक कभी पल्स पोलियो जो खुराक है वो पहुँचाया गया है और वो कोल्ड चेन सिस्टम मेंटेन किया गया है। और जो हमारा पास हाउस टू हाउस सर्वे करके लाइन लिस्टिंग भी है। सारे बच्चे जहाँ जो अपने एरिया का बच्चे कौन कौन है 0 to 5 साल से जो 5 से कम उम्र बच्चे हैं उनका लाइन लिस्टिंग भी है, उसको देखा जाएगा और उस दिन पल्स पोलियो 2 ड्रॉप पिलाया जाएगा। तो जैसा कि आप सभी जानते हैं कि ये जो पोलियो जो बीमारी है ये एक वायरल डिजीज़ है और ये लाइलाज है। अगर एक बार हो गया तो बट ये एकदम 100% प्रिवेंटेबल है। अगर उसको ये रोका जा सकता है तो नियमित रूप से टीकाकरण करके। तो हर साल जैसा कि आप लोग टीकाकरण के लिए बहुत समुदाय बहुत सेंसिटिव है क्योंकि सालों साल करते आ रहे थे, तो लोग जान चुके हैं, जानकारी है और मीडिया भी जैसा ही पहले भी कोऑपरेट करते थे, लोगों को जानकारी देते थे, वैसे इस बार भी लोगों को जानकारी दे। और जो बच्चे हैं 5 से कम उम्र बच्चे अगर कोई परिवार में है वो लोग नज़दीकी पोलियो बूथ में जाकर और 2 खुराक बच्चों को पोलियो बूंद पिलाए। और ये इस जो अभियान से जो पहले भी हम लोग 100% पोलियो देते थे, वैसे ही इस साल भी आप लोग का सहकार चाहते हैं और लोग वैक्सीनेशन 100% कवरेज देने के लिए आप लोग कोऑपरेट करें। धन्यवाद।
So what are the steps do you take for the special children if you have any?
Yeah. The special children का कैसा है कि हम लोग बेसिकली जितने भी स्पेशलाइज्ड होम्स हैं उनमें टीम भेजते हैं हम लोग, वी सेंड देम टीम। ठीक है, अगर जैसे मतलब स्पेशल सिचुएशन मैंने बोला कि जो बूथ में नहीं आ पाएंगे, आज घर में कोई है नहीं, बच्चे को ले जाने के कोई भी नहीं है, या बच्चा आज बीमार है या बच्चा हैंडीकैप्ड है जो जा नहीं पाएगा, तो हाउस टू हाउस जो मॉपअप राउंड होता है उस मॉपअप राउंड में उसको कवर करेंगे हम लोग।
कोई कोई पेरेंट्स का डाउट हो जाता है, तो पिछले 15 दिन पहले ही पोलियो पिलाया था, अभी देना कि नहीं देना। ऐसे सिचुएशन में ये नेशनल इम्यूनाइजेशन डे है और 2 बूंद पोलियो पिलाना ज़रूरी है। अगर पिछले हफ्ते अगर बच्चों को पोलियो पिला है तो भी कोई नुकसान नहीं है, इस बार भी दे सकते हैं।
भारत की पोलियो से जीत की कहानी बड़े बड़े शब्दों में लिखी जाएगी, पर इस जीती हुई लड़ाई को कायम रखने के लिए हमें अपने प्रयासों को जारी रखना होगा जब तक दुनिया से पोलियो का खतरा पूर्ण रूप से टल न जाए। खतरा है बरकरार, इसीलिए पोलियो की खुराक पिलाना है हर बार। 2 बूंद हर बार, पोलियो पर जीत रहे बरकरार।